Imagine breaking your arm 45,000 years ago. No hospital, no x-ray, no anesthetic, no antibiotics, just you, your group, and a bone sticking out of place somewhere in the mountains of what is now northern Iraq. By every modern instinct, that should be a death sentence. And yet, in a cave called Shanidar, archaeologists found proof that it wasn't. In the late 1950s, a team led by archaeologist Ralph Selecki uncovered the skeleton of a Neanderthal man now known as Shanidar I. What they found written into his bones was almost unbelievable. His right arm had been broken so severely, so long ago, that it had partially withered and may have been amputated near the elbow. He was blind in one eye. The bone around the socket healed into a strange, deformed shape. He'd lost much of his hearing. He walked with a pronounced limp from arthritis and old injuries in his leg and foot. Individually, any one of these might have been survivable. Together, they should have been fatal within weeks in a world with no safety net. But Shanidar I didn't die of his injuries. He lived for years afterward, probably into his 40s, elderly by Neanderthal standards. And that timeline is the real discovery here. A one-armed, partially blind, partially deaf man with a damaged leg could not have hunted. He almost certainly could not have kept up on his own during migrations. Someone was feeding him. Someone was helping him move. Someone, 45,000 years ago, decided that a badly broken body was still worth keeping alive. This wasn't a one-off. At a cave called La Chapelle aux Saints in France, another Neanderthal skeleton, an older man riddled with arthritis and missing most of his teeth, shows the same pattern. Injuries so severe he shouldn't have survived them alone, yet he lived on. Some researchers push back on how far to take this. Resilience isn't proof of compassion, and Neanderthals may simply have been tougher than we assume. But the bones themselves don't lie about one thing. Healing happened. Which means, at some point, someone had to notice a broken limb, hold it still, and wait. We don't know exactly what that first splint looked like. Bark, hide, and plant fiber don't survive tens of thousands of years the way bone does, but we do know where the trail picks back up in the written record, and it's startlingly specific. Around 1600 BCE, an Egyptian scribe copied out a document that may already have been over 1,000 years old by the time he wrote it down. Today we call it the Edwin Smith Papyrus, named after the American who bought it in Luxor in 1862. It is the oldest surgical text ever discovered, and it reads less like magic and more like a modern trauma manual. 48 case studies, organized head to foot, each one following the same format: examination, diagnosis, and prognosis. And that prognosis came in exactly 3 flavors: an ailment I will treat, an ailment I will contend with, and, chillingly, an ailment not to be treated. Cases the physician judged as hopeless from the start. Several of those 48 cases are fractures, described with real anatomical precision: a broken collarbone, a broken upper arm, a broken nose reset by hand. The instructions for a fractured limb are recognizable even now. Align the bone, immobilize it. Don't force what won't move easily. This wasn't guesswork passed down as superstition. It was documented technique. And we don't just have the writing. We have the evidence on the bodies themselves. Egyptian mummies excavated from cemeteries dating back to roughly 3000 BCE have been found with splints still in place. Bundles of reed or bark, padded and bound tightly with linen bandages wrapped around healed forearms and legs. Someone set that bone, packed it, wrapped it, and left it to knit back together, and it worked well enough that the splint was still there thousands of years later. The techniques didn't stay still. By around 400 BCE, the Greek physician Hippocrates was writing entire treatises specifically on this problem, texts called On Fractures and On Joints. He described using steady traction to pull a displaced bone back into alignment before splinting it, and he's credited with designing a device now called the Hippocratic bench, a system of ropes and leverage used to snap a dislocated shoulder back into its socket. Some of the reduction techniques Hippocrates wrote down are still taught in emergency medicine training today, more than 2,000 years later, essentially unchanged. None of this was gentle, and ancient physicians didn't pretend otherwise. Pulling a badly displaced bone back into alignment meant fighting against the patient's own muscles, which clench involuntarily around an injury. The solution, described again and again across these ancient texts, was steady, sustained traction rather than a sudden yank, a slow, controlled pull that could overpower muscular resistance without tearing anything further. Patients were sometimes given wine to dull the edge of it, or simply held firmly in place by several assistants while the physician worked. There was no anesthesia and no way around the pain. It was simply accepted as the cost of walking, or gripping, or lifting again afterward. Rome inherited and refined this knowledge. The physician Galen, who treated gladiators and studied anatomy through animal dissection, pushed bandaging and splinting technique even further, and his writings shaped European medicine for well over 1,000 years afterward. When the Roman Empire fell, that knowledge didn't disappear. It moved east. Around 1025 CE, the Persian polymath Ibn Sina, known in the West as Avicenna, completed an enormous medical encyclopedia called the Canon of Medicine. It gathered, tested, and expanded on centuries of Greek and Roman surgical knowledge, including detailed sections on fractures and dislocations, and it described specific devices for applying steady traction to a broken limb before setting it. For roughly the next 600 years, the canon was standard medical reading not just across the Islamic world, but in European universities as well, quietly carrying the science of bone setting forward through the very centuries when so much other ancient knowledge was being lost. Bone-setting knowledge was developing independently on the other side of the world as well. In Han Dynasty China, around the 2nd century CE, the physician Hua Tu became famous for his surgical skill, and Chinese medicine developed its own dedicated bone-setting tradition, known as Zhengu, built around manual reduction techniques passed down through specialist practitioners rather than general physicians. Like its counterparts in Egypt, Greece, and Persia, it treated a fracture as a problem with a repeatable, teachable solution, not a wound to be prayed over, but one to be physically corrected. Through the Middle Ages, something else interesting happened. Bone setting split away from formal medicine entirely. In much of Europe, bone setters were a separate hereditary trade, families who passed down the skill of feeling for a fracture and pulling it straight, generation after generation, completely outside the university-trained physicians of the day. People often trusted the local bone setter over the doctor, and for a very practical reason, bone setters were often better at it. It wasn't until the 19th century that the two worlds properly merged. The next real leap came in 1851, from a Dutch military surgeon named Antonius Matthijssen. Treating soldiers in the field, he needed something better than wooden splints and loose bandages, something that could harden around a limb and hold its exact shape. His solution was simple: bandages soaked in plaster of Paris powder, wrapped around the injury, left to set hard as it dried. It is, structurally, almost exactly the cast still used in hospitals today. And then, in 1895, a German physicist named Wilhelm Röntgen discovered a strange new kind of ray that could pass through human flesh and reveal the bone underneath on film. For the first time in the entire history of this problem, doctors could actually see a fracture before they touched it. Guesswork by feel, the method every healer from Shanidar to Cairo to 19th century Holland had relied on, was over. Even the modern word for this entire field carries the history inside it. Orthopedics was coined in 1741 by the French physician Nicolas Andry, built from the Greek words for straight and child. His original concern was correcting bone deformities in growing children, not treating adult fractures at all. The name stuck and expanded to cover the whole science of bones, joints, and how to fix them, long after its narrow original meaning was forgotten. So the next time you or someone you know breaks a bone and walks out of an emergency room a few hours later with a lightweight cast and a set of x-rays, it's worth remembering what that moment actually is. It's the end of a chain that runs back through a Dutch military hospital, through Hippocrates and his ropes, through an Egyptian scribe copying out a 1,000-year-old medical text, through a mummy wrapped in linen and bark that held for 5,000 years, all the way back to a cave in Iraq, where someone looked at a badly broken man and decided 45,000 years ago that he was still worth keeping alive. The materials changed, the